We believe that every patient at every phase of life is touched upon by the neurosciences. The goal is really to change the future of the way care is delivered, research is conceived, and we educate providers and also really the community at large about how to care for patients that either already do or may have neurological disease.
When a patient has a new diagnosis of neurological disorder, it can be frightening, confusing, and complex. And one of the reasons that we formed Mass General Neuroscience was to make that journey easier.
There are over 600 neurological illnesses that account for a major part of the morbidity and mortality in this world. But we are finally at the point in neurology where we have the tools and the technology to make huge impacts in therapies for our patients.
The Mass General Hospital has been kind of a magnet for some of the best and brightest in the field. When people think of a hospital, they don't think of a biomedical research institute, and yet there's basically $1 billion a year of funded research that comes to the Mass General across all the different departments. That's pretty unique.
There's no other institution that has the depth of expertise that we have at Mass General in the neurosciences. We are really the leaders in neurology, psychiatry, and neurosurgery, and we're bringing all that expertise from multiple departments to work together to solve brain diseases.
Our goal is to make it so that patients don't have to fear the idea that they may be at risk for a neurodegenerative disorder or another neurological illness, but rather that they can be prepared to do the right things throughout their life in order to prevent such illnesses.
Mass General Neuroscience will devote the resources of all of the neurosciences at Mass General to identify what's best for the brain and nervous system of our patients.
We all recognize that the brain, as complex as it is, does not discriminate between diagnoses or departments, and that people who come in with brain-related problems really can benefit from evaluation and care from across different disciplines.
The exciting part about the collaborative teams are that we can bring together a great depth of expertise in individual areas, and then also different perspectives.
I'm very excited to be partnering with my colleagues in psychiatry and neurosurgery and many other departments at Mass General to bring all our knowledge in the neuroscience forward together so we can really accelerate how we care for and how we develop treatments for our patients.